This is the demonstration of physiotherapy clinical examination on the cervical spine area. This is on the posterior side. For this examination, before that, you also have some hypothesis in your mind, but beside the clinical pattern, you may think about different structures instead, use a structures approach. For the examination, beside the basic observation, basic temperature palpation, what else we do is that I recommend it first, you feel the upper trap and neck extensor tension. Those are the muscle very prone to have high tension and overuse, especially patient with computer work. Then before you really press on the joint, you better feel the muscle first. Because the muscle is tense, okay, then it's hard to, you don't know whether it's a muscle or the joint restriction. So you can feel the muscle tension. Then you compare, now I'm doing the right side. Then I compare with the left side, although I use different fingers, but I don't need to change my position. Some people will have very obvious cervical lordosis. You may want to lower the head rest. Ask the patient to do a chin tuck position. It will expose very well, especially the C3-4. C3-4 usually is covered by a very thick layer of neck extensor. So only if the head comes very down, you can dip your finger, the tip of your finger to C3-4, you can feel a very localized discomfort that will cause the discomfort of the shoulder as a referral symptom. Okay, for those with very tight shoulder but you don't feel any tension in the upper trap. And then for some patients, they always complain very tight here, but when you do the assessment of the upper trapezius muscle, you don't feel the symptoms and not very tight. Then you go and check the C3-4 unilateral accessory movement. Sometimes it's a referral symptoms. Okay, and then don't forget that a lot of people, they like stretching their neck. They have a ligament or a muscle strain on the neck. Then you need to really dig your fingers in to feel any particular localized tenderness of the ligament discomfort. Usually, if overused, the discomfort is like one area. If localized acute sprain or strain is like one spot, then you feel very particular discomfort, but after that you check reference as a next level, they say no discomfort. And then one level below, no discomfort. But double check on the level, yes, it's only localized. That is likely to be a strain injury, then they should have the initial rest, no stretching, no mobilization for 1 week. Other than that, for what I also will check on the cervical spine, posteriorly I will check this location called cervical trigeminal nucleus. It's a neurological structure, very dense in the upper cervical area. Sometimes because of the cervicogenic headache, they have hypersensitivity. Visualize that if the skull area, there's a one line, the junction between the skull and the cervical spine. Use the tip of the finger, press hard for here. Can press even for healthy people, if you press quite hard, still no discomfort. But if they have active headache, no matter migraine headache, cervicogenic headache, and other headache, they have a common sensitivity around this area. Then you can find out. Okay, this palpation of cervical trigeminal nucleus. And then for C1-2, you don't expect to be able to do the accessory movement posteriorly because it's very hard covered by the skull. I suggest you do it anteriorly. You can check with our anterior video to revise that. Those are the examination of the posterior neck.